Anyone? Hello?
Collection of nerves.
Upper extremity.
Okay, perfect. So brachial basically the term brachial stands for hand, and plexus means like a network of nerves. So basically they are the network of nerves which supply your upper limb, right? Mainly hand. So these plexus are both motor and sensory. What do I mean by motor and sensory? They're going to supply some muscles which undergo some motor activity, like some related to your movement, and it's also going to take the sensory responses in return back to your brain, right? So normally, we know that we have spine, and spine give a lot of nerves, right? Nerve roots. So like we have like cervical area which give us like 8 nerves, right? We have thoracic which like give off 12 spinal nerve. We have lumbar 5 and sacral 5, right? So here you guys can see the plexus. These are basically your brachial plexus. So you can see it's basically divided into like certain roots. You have trunks, you have division, cords, and in the end, like individual nerves come out and it supplies different muscles, and it undergo like a motor and sensory supply of your upper limb. We'll be discussing each one in detail, right? So the first one, let's see here. Let's discuss our first nerve, that is axillary nerve, right? So the nerve which basically arises from brachial plexus are like your axillary nerve. We already are aware of axillary nerve. Yesterday we discussed it, right? Axillary nerve. We have our radial nerve. You guys can see here. Look, you have your ulnar nerve, your median nerve, your axillary nerve, your musculocutaneous nerve. Is that right? Hello? Hello?
Yes, sir.
Okay, then we have trunks. We'll be discussing trunks as well. Here you guys can see like you have like upper trunk, lower trunk, right? These two trunks are significant. We are going to discuss that in detail. And we have our last nerve, which we'll be discussing in the end, that is long thoracic nerve, which basically arises from the roots. Here you guys can see, right? So we'll be discussing axillary first, then radial, median, ulnar, and musculocutaneous, right? So the first one which we are going to discuss is axillary nerve. So you guys can see here the axillary nerve coming out like that. Okay, let me just change the color. So can you guys just tell me which muscles do axillary nerve supply? Yesterday we discussed that.
Deltoid.
Perfect. It supplies deltoid. What's the function of deltoid? We discussed abduction above 15 degree. Remember, to 90 degree. Remember?
Yes.
So from 15 degree to 90 degree. For example, if someone is having like rupture or damage of this nerve, how can one have damage? Yesterday we discussed that. Anterior dislocation of your shoulder. Remember?
Yes.
Yes, anterior dislocation of your shoulder can damage this nerve. Okay, once this nerve is damaged, I would say that what happens now, you cannot abduct your arm above 15 degree. What else? If the nervous supply of deltoid is gone, so can I say now it would undergo atrophy because you do not have like stimulus coming into your deltoid muscle?
Yes, sir.
Okay, so atrophy of deltoid. And okay, so anterior dislocation, one of your UL MCQ, if you guys remember, right? Okay, then the next nerve which we are going to discuss is your radial nerve, right? Radial nerve. For the radial nerve, you should just like memorize that radial nerve basically supplies the posterior compartment of your entire upper limb. What do I mean by posterior compartment? The muscles present in the posterior compartment, like in the upper arm you have your tricep muscle, right?
Yes.
And in the forearm, all of the extensors of your forearm and your hand, right?
Mm-hmm.
So all of them are supplied by radial nerve. Okay, let me just give you a question. For example, if the radial nerve is damaged, can I say that now the flexors are going to be, like dominated, and we're going to see wrist drop?
Yeah.
Wrist drop. Why? If the radial nerve is gone, all of the function of your extensor muscles are gone. If the extensors are gone, what happens? Flexors would dominate, right? Hello?
Yes.
Yes, sir.
If the
You can
flexors
attend this
don't.
point.
Okay, so we discussed that you have the posterior compartment muscle, that is tricep muscle in the upper arm, right? Like in the upper hand, and your extensor in your forearm are basically supplied by radial nerve, right? At the back of your hand, posterior compartment. So whenever the radial nerve is damaged, what happens now? The extensor of your forearms are gone. If the extensors are gone, what happens now? The opposite muscle would dominate, right? Domination of opposite group muscle. What are your opposite group muscles for your extensor? That are flexors, right? So what happens? Your wrist is going to be flex, and flex wrist means you can just simply say wrist drop, right? Hello?
Yes, sir.
Okay, but what's the sensory supply? Radial nerve also supplies some. Okay, this was a motor innervation towards to like to your muscles. The sensory supply basically is supplied the back of hand and forearm, right? So this is your forearm. At the back of forearm and hand, basically radial nerve supply that, right? It's a sensory innervation. So with the lesion of your radial nerve, you are also going to see sensation being lost at the back of your forearm and your hand. Is that clear?
Yes, sir.
Oh, okay. So here you guys can see this is like your, okay, this is your wrist drop, right? So if all of the muscles, extensor muscles are gone, the flexor are going to be dominated. Once they are dominated, you are going to see wrist drop. Is that clear?
Yes, sir.
Okay. But another thing which you guys should just keep in mind, we can have like, for example, we discussed that tricep is supplied by your radial nerve. We also discussed that the extensor forearm are also supplied by your radial nerve. For example, if radial nerve is damaged somewhere here in the axilla, so can I say whenever we have damage of nerve here within the axilla, so both the function of tricep and extensor are lost. So what's the function of your tricep? It extend your, yes, please. Hello?
Extends the arm.
Yes, extend your arm. So can I say that extension of your arm is also gone? Along with that, you're also going to see wrist drop, right?
Yes.
Hello? Okay, but we also know that radial nerve, like we have a radial groove within your bone, humerus bone, right? You have a groove, like a specific, a spiral or a radial groove in which your radial nerve, basically runs. So for example, if you have damage of radial nerve somewhere here in the radial groove, so now what happened? Now your tricep is spared, no problem with the tricep, but again, problem with the extensor of your forearm. And you are going to see wrist drop with the function of tricep being spared. Is that clear?
Yes.
Okay. So how can we have radial nerve lesion? It can be due to humeral fracture, right? For example, if the humerus just fractured here, right, we can have damage to the radial nerve. It can also be like due to, like sleeping with an outstretched hand, also known as Saturday night palsy. So what is Saturday night palsy? Like for example, if someone have been drunk on Saturday and he slept over with an outstretched hand over the chair. So again, due to impingement of radial nerve against the bone, it can cause loss of your radial nerve, right? Loss of function of your radial nerve. Is that clear? Hello?
Yes, sir.
Yeah.
Okay. So here you guys can see wrist drop. Okay, and this is basically the radial groove where basically your radial nerves run. You guys can see it here, right? So we can also have fracture here. If the fracture is here, what happened? Tricep is spared, but the extensor muscles of your forearm are not spared, and you're gonna see this drop again. Is that clear? And at the axilla level, what happens? Yes.
So when it was getting damaged at the axilla, so the tricep function was also affected.
Yes, both of them are gone. Simple,
But
perfect. Okay.
at mid
And
shaft, the tricep function is preserved.
yes, that's perfect. So the next one which we are going to discuss is your musculocutaneous nerve. So what is musculocutaneous nerve? Musculocutaneous. It means it's going to supply some muscles, as the name indicate, but it also have some cutaneous or sensory supply, right? So which muscles do musculocutaneous supplies? It supplies your bicep muscle. You know what is bicep muscle? All of you guys are aware of that. Bicep muscle flexes your arm, right? Your forearm. Yes or no? Flexes your arm. For the flexion, here you guys can see an exercise for your bicep muscle, right? Hello?
Yeah.
Okay. But what's the cutaneous part of musculocutaneous? It would basically supply the lateral forearm. So the lateral forearm is basically supplied by your musculocutaneous nerve, right? So here you guys can see the lateral surface, like this surface, the lateral forearm is basically also supplied by musculocutaneous nerve. Okay. So it's obvious that whenever we have, damage to this nerve, what would happen? You cannot flex your bicep, right?
Yes.
Hello? And the sensory supply to the lateral side is also gone. That's so simple, right? Okay. So the next one which we are going to discuss is trunk injury, right? So trunk, we discussed that we have upper trunk and lower trunk, right? They're very important. You guys should be aware of that. Here you guys can see your upper trunk and your lower trunk, right? So this trunk, you can see like it contributes in formation of a lot of nerves. You guys can see it here, like, you know, this trunk is just coming out. It's contributing in a lot of nerve, your axillary nerve, your musculocutaneous nerve. You guys can see it here, right? Your suprascapular nerve. Can you guys just see it?
Yes, sir.
Yes.
If we have damage to this upper trunk, it means that the function of these nerves is going to be disrupted. Is that right? Hello?
Yes,
Yes.
sir.
Hello. Okay, so C5 to C6 trunk damage, right? What happens? Okay, first of all, you guys should be aware that how can we have damage to the upper trunk? How can we have rupture of the upper trunk of your brachial plexus? This is one of your new world MCQ. During childbirth, right? Let me just give you a hint, right? So anyone who is going to give me the details that how can one have rupture of upper trunk?
This is due to traction of the head and the shoulder
Okay,
during delivery.
perfect. Shoulder dystocia. What do we mean by shoulder dystocia? For example, like it's a birth canal, right? Okay. So in the birth canal, for example, if a baby is, you know, coming out and in symphysis pubis is, okay, just give me a second, please. Give me a second. Okay. So in the symphysis pubis, let's suppose if his shoulder is stuck, if the shoulder stuck, and still like, you know, like a maid is basically pulling the head off baby. So what happens now? The angle between the shoulder, okay, this is the head of baby, and this is the shoulder, right? For example, if the shoulder is stuck and still you are, you know, like pulling the head. So what happens? The angle is increased. The angle between the shoulder and neck increases, and this increased angle by pulling out a baby can cause rupture or damage of your upper trunk. Very important. You have a UWorld MCQ on that, right? Hello?
Yes, sir.
Okay. So whenever this stretch tears the upper trunk, which nerves are going to be affected? Here we discussed already, right? Just follow the path, follow the track. Just give me a second. Okay. So if the upper trunk is gone, I would say the suprascapular nerve is gone. Can I say that?
Yes, sir.
Axillary nerve is gone. You guys can just follow it. See? Right? Hello? And musculocutaneous is also gone. Right?
Yes.
So, for now we discussed that whenever we have rupture of the upper trunk, what happens? Three nerves are going to be compromised. Which nerves? Your axillary nerve compromised. Next one is your musculocutaneous also compromised, right? And the last one is suprascapular. So we already know the function of each and every nerve. We discussed it, suprascapular. So if the axillary is gone, it means that the function of deltoid is gone. That is abduction is gone. Can I say that?
Yes, sir.
If abduction is gone, opposite group of muscle, what are they going to do? They're going to adduct your arm, right? Is that right?
Yes, sir.
Okay. If the musculoskeletal is gone, musculocutaneous is gone, if the flexion is gone, so the opposite group muscle, the extensor, would dominate, right? So what would happen at the elbow? You are going to see, yes, extension, right? Extension of arm at elbow, right?
Yes, sir.
Okay, if the suprascapular is gone, suprascapular was supplying your infraspinatus, remember? Which was important for your external rotation. So if the external rotation is gone, so what happened? Now the hand would be internally rotated. So you guys can see a baby with adducted arm. Here you guys can see with adducted arm, right? You guys can see adducted arm and extended at the elbow and internally rotated. So you guys can see this basically give us a clear picture or a specific picture of a condition that is known as Vater tip sign, right? Is that
Yes.
clear?
Yes,
So
sir.
we are going to call it as Erb's palsy or Vater tip sign, right? Or Vater tips hand, right? You guys can see it clearly. Okay, just give me a second. Okay, so we discussed the upper trunk. Let's just come to the lower trunk, right? So you guys can see here whenever the lower trunk is gone, so here you guys can see whenever the lower trunk is gone. So which nerves are going to be compromised? You can just follow the path. You guys can see with your posterior cord. And okay, so which, yes, what do you think? Which nerves are going to be compromised here?
CAT1.
Okay. Okay, specifically, you guys can see the ulnar nerve is gone and the median nerve is gone, right? Ulnar
Yes.
and median, right? Okay. So before discussing that, with like, okay, first of all, let's discuss that how can one have damage, rupture, or tear of the lower trunk? Yes, which condition? This is specific for it.
I think car accident with a friction force.
Okay,
Is it?
okay, if we have a child, he's falling off a tree, what happens? And suddenly he catches one branch, right? So what happens? So with his hand, he's catching a branch. So again, what happened? Okay, this is a child, right? And this is a a tree branch, and if he just suddenly holding that, so what happens? It can cause tear of the lower trunk. Is that clear?
Yeah,
Hello?
clear.
And when the lower trunk tears, the activity or function of ulnar nerve and median nerve is gone. So let's discuss what's the function of ulnar and median nerve. Today we are going to discuss that in hand, but let me just give you a brief overview of that, right? So let me first of all draw the hand. So for example, this is your hand, 1 2 3 4, and your thumb, right? Sorry for the picture, but I think you guys are already know, right? So you have your thenar eminence. You guys know that, right? Intrinsic muscle of hand. What are intrinsic muscle of hand? Simply think of the muscles which are found within the hand, which arises within the hand and inserts within the hand, are simply known as intrinsic muscle of your hand. Is that clear? So you have your thenar muscles and hypothenar muscles. Is that clear? Like this is going to be the thenar muscles and you have your hypothenar muscles. Is that right?
Yes, sir.
Okay. So the thenar muscles are basically supplied by, yes, median nerve, right? Hello.
Yes, sir.
And the
That's
hypothenar muscles are basically supplied by ulnar nerve.
Ulnar.
Okay. We also have a group of nerves which are known as Okay, we also have a group of muscles which are known as interosseous muscles. What do we mean by interosseous? Intraosseous, between the bones. Interosseous or interosseous muscles. What's the function of that? They abduct or adduct your fingers, right? Hello?
Yes,
Yes.
right.
Okay, so they are basically present within your the muscles between your bone. That's why they are known as interosseous muscles. So what's the function of those muscles? They basically, okay, so the palmar one would, yes, what would the palmar one do? The palmar interosseous muscle, abduct or adduct? Hello?
Palmar duct.
Okay, abduction or adduction, palmar side, palmar interosseous muscle.
abduction.
Abduction, I think it's adduction. Yes, please confirm that.
Adduction.
The fingers.
Adduct or abduct?
Adduction, yes.
Ah.
Bad. There is a mnemonic, I think.
Okay,
Bad.
so mnemonic for that is PAD, right? So palmar adducts, right?
Yes.
Okay, so the adduction is basically done by your palmar interosseous muscles, while the abduction basically done by the dorsal interosseous muscle, right? The dorsal. So both of the interosseous muscles, which undergo abduction or adduction, are supplied by ulnar nerve. You know that, right?
Yes, sir.
Okay, and what about the sensory supply? Like for example, if this is the medial side, so from the this this small finger, this pinky finger, and all of the pinky finger and half of the other finger, this sensory is basically supplied by your ulnar nerve, right? And the remaining by
Median.
median nerve, right? This is the sensory supply. It's done by your median nerve. While at the back, again, this 1.5 by your ulnar nerve. But at the back or the dorsum, at the back, sensory supply, radial nerve, right?
Yeah, yes.
Okay. Did you guys understand?
Yes,
Or
sir.
I shall repeat it. Hello?
Can you repeat that?
So ulnar
Okay.
is the same
Can you repeat
cavity.
it?
The front
Okay, so
back.
I'll just repeat it, right? So we have our median nerve and ulnar nerve, right? So we have thenar eminence, and we have a group of muscles there. We'll be discussing that in hand, hand module right after this lecture, right? So the thenar eminence, the muscles, the intrinsic muscle are basically supplied by median nerve, right? That's the motor supply. What's the sensory supply? This 3.5, 1, 2, 3.5. Sensory is supplied by your median nerve. Is that right? Hello? Then comes your ulnar nerve. So the hypothenar muscles are basically supplied by ulnar nerve. What's the sensory supply? Sensory supply is basically your 1.5 finger, which I have marked, right? Okay, what other muscles do? Ulnar nerve supply interosseous muscles. Is that clear?
Yes.
But we have, yes, but we have another group of muscles, lumbricals. Don't forget that. What does lumbricals do? Yes. So we have like lumbrical, 2 lumbricals here and 2 here, right?
Touch sensations.
Okay. So you have lumbrical
Yeah.
muscles, right? So you have lumbrical muscles, which I have marked with blue. So the lumbrical muscles for these first two, like these fingers, the second and third finger, again the motor supply is by median nerve, right? But for these two lumbricals, the motor supplies comes from ulnar nerve. Is that clear?
Yes, sir.
That's so simple, right? Okay, what's the function of lumbricals? Let's discuss that, right? For example, if I have a hand and, for example, if I'm just putting my hand and just making L of it, right? L, letter L. Like, for example, this is your metacarpophalangeal joint. Metacarpophalangeal joint. And this is your and these like joints are your interphalangeal joints. Right? So what's the function of lumbrical? Simply think of it would just make L of your hand, L from your hand. It's a letter L, right? You can see lumbricals for L. So it would cause flexion at metacarpophalangeal joint and extension at interphalangeal joint. Can I say that?
Yes.
Hello?
Yes, yes.
Yes,
We'll
sir.
be
Yes.
just discussing that in hand module. Don't worry about that. So if it's forming L of your hand, so it means it would just cause flexion here at metacarpophalangeal joint and extension here at interphalangeal joint. So in this condition, which we discussed, the lower trunk injury, both of the function of median and ulnar nerve is gone. So can I say that now the innervation to both of your lumbricals of these two fingers and these two fingers is gone? It means you cannot form L, right? Or the function is going to be opposite. So now we'll be seeing extension at metacarpophalangeal joint and flexion at interphalangeal joint. Can I say that?
Yes.
Right? So if we have, you can just, think of if we have extension of metacarpophalangeal joint and flexion of your interphalangeal joint. So it would just give you a claw hand. You can just do that. You just do that. Just extend your finger here at metacarpophalangeal joint. This is extension, right? And flex it at interphalangeal joint. Why? If the median nerve is gone. So can I say it would just result in a claw hand? Hello?
Yes, sir.
Yes.
Okay. So whenever we have like a rupture of the lower trunk, it would result in damage or compromise of your ulnar and median nerve, which would result in claw hand. Is that clear?
Yes, sir. Claw.
Okay.
Last sentence. Can you repeat the last sentence, Doc?
Okay.
When you
So
have
it would result in claw hand, right? Claw hand. Like normally we discuss, okay, the functions of lumbricals are gone. Simply think of, if the lumbricals are gone, you cannot form L, right? For the L, we need flexion at metacarpophalangeal joint and extension at interphalangeal joint, right? So what happens now? You'll be having extension of metacarpophalangeal joint and flexion of interphalangeal joint, which is going to give you claw hand. Is that clear?
Okay.
Okay, so the next topic which you are going to discuss is thoracic outlet syndrome. So what happens in thoracic outlet? First of all, you should know what is thoracic outlet, right? So thoracic outlet is basically this space which you can see, like the space which is above your first rib and behind the clavicle. So this is your clavicle, behind the clavicle and above your first rib, you have a space or an outlet which is known as thoracic outlet, right? But if you just, zoom in the picture, so this nerve, the brachial plexus, come out in between two muscles, that is scalene muscle. So you have anterior scalene muscle and, yes, middle scalene muscle. And in between this brachial plexus and the blood supply to your hands, it came out, right? So you have a UWorld MCQ. They are going to ask you this, that in between which muscles do the brachial plexus come out or the blood supply to your hand comes out in thoracic outlet, right? So that's basically in between anterior and middle scalene. Is that clear? Okay. So sometimes we can have an extra rib, right? What's an extra rib? That is 7 cervical rib. So if someone is having an extra 7 cervical rib, so there are increased chances that this rib can compromise, these brachial plexus, right? It can cause rupture of the brachial plexus, and it can also cause, compromise of the blood supply as well, right? Okay. So which trunk do the extra rib damage? Upper trunk or lower trunk?
Lower trunk.
Lower trunk, right? Or lower plexus. So lower plexus are going to be affected. If the lower plexus are affected, so it means that this individual will be having claw hand, right?
Yes.
Median and ulnar nerve function is gone. And venous compression can also be seen. The arterial compression, again, these arteries can also be compromised. Veins can also be compromised, which can lead to arm ischemia. Is that clear? Hello?
Yes, sir.
Okay.
Yes, sir.
So let's discuss our last nerve, that is long thoracic nerve. Long thoracic nerve. So we discussed that long thoracic nerve comes from the root. We discussed that, right? We have seen in the picture. What's the function of long thoracic nerve? Yes, it innervates the serratus interior. Serratus interior muscle, right? What's the function of serratus interior muscle? Yes, it
Above
keeps,
90 degree.
sorry?
Abduction above 90 degree.
Mhm. Yes, that was also one of the functions. Yes, that's correct. But other function is that serratus interior, basically, like for example, this is your scapula. So it keeps scapula against your, the thorax, right? So it would just push the scapula or pull scapula against the rib cage, right? So its function is to keep scapula firm against the rib cage. If the long thoracic nerve is gone, so it means serratus interior innervation is gone. It means you have no one to keep your scapula against your rib cage. Is that clear? So, for example, if you tell this individual with long thoracic nerve injury to just keep his outstretched hand on the wall and push it, right? If I'm just telling an individual who I'm suspecting of long thoracic nerve injury, I'll just tell him to outstretch your hand and push it against the wall. So what happened? His scapula is going to be coming out, or it's going to detach your, yes, rib cage, which would result in winging of scapula. You have a UWorld MCQ on that. In UWorld, they are going to tell you, we have an individual, we tell him to, with an outstretched hand, just push the wall. What happens? His scapula came out. So what's that? Which nerve is compromised? Long thoracic nerve, winging of scapula. Is that clear?
Yes, sir.
Yes,
Okay.
sir.
Okay, so with this, we have, finished our brachial plexus. So let me just, discuss. Okay, just give me a second. Let's discuss hand. Okay, just give me a second. I'm just opening the slides. Did you guys understand the brachial plexus?
Yes, sir.
Yes, sir.
Okay. So you have a lot of MCQs of your word, which we already discussed. Like you are going to see like MCQs on the upper trunk injury. You have a lot of MCQ on that. The lower trunk injury, like each and every point which we discuss is, your word MCQs into. Okay. Just give me a second. Hello.
Hello.
Okay, so can you guys just see my screen?
No. Yes.
Okay, perfect. So let's discuss our hand, right? Hand. So we know that, okay, so we already know the nerve supply, we discussed that. So basically we have thumb, and thumb we call it as first digit, right? So index is our second digit, we call it as second digit. Middle finger is basically known, okay, so this is your first digit, your second digit, your third digit, and your fourth digit, and fifth digit, right? So whenever I just refer to, like, these digits, so you should know that, like, for example, if I'm telling you third digit, so think of middle finger, it's the second, think of index finger. Is that right? And we have two surfaces, palmar surface and dorsal surface. So this is going to be your palmar surface, and at the back of hand is basically your dorsal surface, right? And I'll also be using the term lateral or medial, right? So you guys know that this small finger is towards the medial side. So whenever I'm referring to the medial aspect, so think of small digit, the pinky, okay, or the fifth digit. Or if I'm just referring to the lateral side, so think of, I'm just talking about your thumb. Is that clear?
Yes, sir.
Okay, so here you guys can see that different bones which make your hand. So you have your carpal bones. We'll be just discussing that in this module. You have your metacarpals. You guys can see it here. You have your proximal phalanges, intermediate phalanges, and distal phalanges, right? So the joints between phalanges are known as interphalangeal joint. Joint between your metacarpal and phalanges is known as metacarpophalangeal. Is that clear? So these are the terms which we'll be using, right? So let's discuss ulnar and medial nerve. So we already discussed the nerve supply and the function of ulnar and medial nerves, but it's a kind of review, right? So we discussed that. Okay, so now you guys are going to be telling me that, for example, I'm marking this like 1.5 finger. So the sensory supply to this part of the little finger and your fourth digit, your fifth and fourth digit. Can you just tell me the nerve responsible for that, for the sensory supply?
Ulnar.
Ulnar, right? Okay, what about this one? Like this 3.5 fingers, sensory supply.
Median.
Median.
Okay, perfect. Median. We already discussed that it's a kind of quiz for you guys, right? Okay. So we have intrinsic muscles, right? What's the name of these muscles? Thenar or hypothenar?
Thenar. Thenar.
Okay, thenar. And what about these muscles?
Hypo.
Hypothenar.
Hypothenar. Okay, what's the nervous supply of thenar muscles?
Median.
What's the nervous supply of hypothenar?
Ulnar.
Ulnar.
Ulnar. Okay, perfect. Okay. What about interosseous muscles? Interosseous muscles. There,
Ulnar.
okay, different group of interosseous muscles. Palmar and dorsal, right? Palmar and dorsal. What's the function of palmar interosseous muscles? Adduction or abduction?
Adduction.
Adduction.
Perfect. Adduction. What about the dorsal?
Dorsal abduction.
Abduction. Perfect. What's the nerve supply?
Ulnar.
Ulnar nerve. Perfect. What about lumbricals?
Median nerve supply.
Okay, so these two, which are basically supplying your second and third digit, they're basically supplied by median nerve, and the lateral basically are supplied by ulnar nerves, right? So let's discuss thenar muscles in a little bit more detail, right? So let's discuss thenar. So in thenar muscles, basically we have 3 muscles, right? And what's the name of those muscles? That are abductor, pollicis, brevis. Okay, what do pollicis mean? Pollicis means like refers to your thumb, right?
Yeah.
Okay, so we have flexor, pollicis, brevis, and we have opponens, pollicis. Is that clear? So the term brevis basically like refer to short muscles, right? Whenever we have short or small muscles, we use a term brevis for that. Whenever we have long muscles, we use a term longus for that. Is that clear? And the pollicis basically refers to, yes, your thumb. So can I say that abductor, pollicis, brevis are small muscles which would abduct your thumb? Can I say that? Abduction, abduction of your thumb.
Yes.
Okay. and together they form thenar eminence, right? You know, the protrusion at your thenar area are made by these muscles, right? Okay, your flexor pollicis brevis, can I say that they are like it's a small muscle which flexes or which have inflection of your thumb? Can I say that? Okay, opponents, it has in opposition movement. What is opposition movement? Let me just tell you here, right? So if someone is counting his fingers with his thumb, this is known as opposition movement. Is that clear? Hello?
Yeah.
Okay, so let's discuss like our hypothenar muscles. Hypothenar muscles. Hypothenar muscles, we know that basically they're going to be present here, right? Okay, so we have opponents digiti minimi. Opponents digiti minimi. We have flexor digiti minimi, right? And we have abductor digiti minimi. So we know that the digiti minimi word, basically we use it for this
Minimi.
small fingers, right?
Minimi. Complete.
Hello?
Yes, sir.
That's
Okay.
it, yeah, man.
So what's the function of these individual hypothenar muscles? Like opponents is going to undergo the opposition movement of your small finger. Flexor digiti minimi is going to undergo flexion of your small finger, and abduction, again abduction of your small finger. Is that clear? What's the nervous supply? We already know that ulnar nerve, right? Hello? Is that clear? Can you guys just hear me?
Yes.
Hello?
It's clear.
Okay, perfect. Then we have our intraosseous muscles. We already discussed intraosseous muscles. Muscles present between intraosseous, osseous for bone, right? In between the bones, here you have intraosseous muscles, right? And what's the function? We discussed the nervous supply is ulnar nerve. And what's the function of these muscles? We already know that the dorsal AB duct, palmar A duct, right? Hello?
Yes.
Okay, then we discussed our lumbricals. How can you forget your lumbricals? So the lateral two lumbricals, or the lumbricals which are supplying your second and third digit. What's the nervous supply for that? The lateral second and third digit. Yes.
Ulnar.
Median.
Median.
Median nerve. What about the medial fourth
By ulnar.
and fifth?
Ulnar.
Ulnar nerve, right? And what's the function? Making L. You know, flexion of metacarpophalangeal joint and extension of your interphalangeal joint. Is that clear?
Yes.
Yes.
Okay. Okay, perfect, right? Okay, so whenever both of these nerves are gone, median, okay, in which condition we discussed lower trunk injury, median and ulnar, so it's gonna end in a condition claw hand. We already know that. Is that clear?
Yes, doctor.
Okay, so let's discuss extrinsic hand muscle. What are extrinsic hand muscles? Idea is really simple. Extrinsic. These hand muscles, you know, originate outside of your hand, and they're like they're basically your hand muscles, but their origination or they originate outside of your hand, right? So one of the muscle is flexor digitorum profundus, right? Flexor digitorum profundus. So flexor digit, it would flex your digits profundus, right? It comes out of your hand, right? Somewhere in the forearm. It just arises in the forearm, and it just, you know, like insert within your hand. And it's responsible for making a fist. Like if you are like, you know, flexing all of your digits, so it helps in making fist. Is that clear?
Yes, doc.
Again, like you have your flexor digitorum profundus, so you know, like 1, 2, 3, 4. It's going to supply for all of your like fourth, fifth, okay, second, third, fourth, fifth finger, right? But remember, again, the lateral two are supplied by your median nerve, and the medial two. Hello, can you just hear me?
Yes.
Ulnar nerve. Yeah.
They are supplied by ulnar nerve, right? So you guys can see that the distribution is almost same as lumbricals. Is that right? Because the lateral two lumbrical were also supplied by the median, and the medial two are also supplied by your ulnar nerve, right? Lumbricals. Can you guys just see that?
Yes,
Why?
doctor.
Hello?
Yes.
Okay, so you guys can see that the nervous supply is almost same as that of lumbricals, right? Why? Because the lumbricals arises from the tendons of these, this flexor digitorum profundus, right? Remember, lumbrical arises from the tendons of, they do not arise from like anywhere in the bone, right? So they arises or they came out of tendons of flexor digitorum profundus. So that's why the nervous supply of the lumbricals and the tendons or the insertions of flexor digitorum profundus are same. Is that clear? Hello?
Yes, sir.
Okay. Okay, perfect. So let's discuss the extensor surface, the extrinsic hand muscle extensor, right? So we know that for the extension, basically, we have muscles which are present in the posterior compartment supplied by radial nerve, remember? Hello?
Yes, sir. Radial.
Okay. So what's the function of these extensor? Like for example, if we have like flexor digitorum profundus. So we also have extensor digitorum, right? Extensor digitorum, which is going to come from the posterior compartment supplied by radial nerve, right? What's the function of that? It would extend your fingers, right? If the flexor was, used for making a fist, so what would be the function of extensor digitorum? Extension of your fingers. Is that clear? Hello?
Yes.
Yes,
Oh,
doctor.
okay. Okay, perfect. So let's discuss different deviation. We have wrist deviation, right? So wrist can be deviated like in many directions. So one is our like ulnar deviation and other is our median or like a radial deviation, right? So can you just tell me this wrist is deviated toward ulnar or radius? What do you think?
Allah. Allah
Hmm?
deviation.
Is it ulnar or is it just think of? It's ulnar deviation.
Y- Yes, sir.
Yes,
Okay, so
Allah
it's ulnar
deviation.
Ulnar
deviation, right?
Yeah,
deviation.
Allah
Ulnar
deviation.
deviation. So why do we see ulnar deviation? The idea is really clear. Whenever we have problems with the median nerve, so the opposite compartment muscles are going to dominate and it's going to deviate, the race towards the ulnar side. On the same side, if we have problems with the ulnar nerve, we'll be having radial deviation. Is that clear?
Yes.
Okay. So median nerve lesions. So it's a kind of revision. So can you just tell me whenever? Okay, let me just pick someone for that. Okay, please raise your hand, those who want to participate in the discussion, please. I want to ask you something about median nerve. We already discussed that. Okay, yes, Dr. Divanshi. Okay, Dr. Mariam and Dr. Shafiq. So Dr. Shafiq, can you just tell me, for example, if you have an individual, if his median nerve is gone, can you just tell me what would be the motor deficits and the sensory deficits seen in this individual?
The median
Okay,
nerve will be
let me just let me just write it down here. Just give me a second. Okay, when the median nerve is gone, which muscles function are which deficit or which muscles function is compromised? Yes.
there will be yeah, the flexor what's this digitorum profundus
Okay,
and
so the lateral two flexor digitorum profundus. Can I say lateral two lumbricals?
yes, and the lateral two
And what
lumbricals and the
about
lateral
thenar muscles, right?
the thinner muscles will be affected.
Okay, and what about the sensory?
Sensory, the lateral 3.5 fingers
Okay, three
will
and a
be
half, right? Three and a half, I would say. 3.5 fingers, sensation is gone, right?
yes.
Okay, so for example, if a person is having median nerve injury and like, for example, if the two lumbricals are gone, right? So what happens if I just tell this individual to make a fist? So what do you think, if the lumbricals functions are gone, if I just tell this individual to make a fist, already the ulnar nerve is, good, it's working, right? So what happens, he is going to form a sign, which is basically known as
It's
Bob's blessing, right? Bob's blessing
yes.
or hand of benediction. Why? Like already the ulnar nerve is working, right? And it means that the lumbricals are fine. So what would happen? You can, flex both of these digits. But the lumbricals here aren't fine. So you cannot flex at metacarpophalangeal joint. What was the function of lumbrical? Flexion at metacarpophalangeal joint, right? And extension of interphalangeal joints. So here you guys can see that they are a kind of flexed here, right? The function is compromised. Function of your lumbricals are compromised. So whenever you tell this individual to flex or to make a fist, he'll just make a sign which is known as Pope's blessing or hand of benediction. Is that clear?
Yes.
Okay. And normally at rest, he will be just forming a hand which is known as a hand. And what's the idea? Again, the idea is simple. You guys can see here, again, the lumbrical function is gone. So he cannot flex here while he will be flexing at interphalangeal joints, right? So you can just, okay, and what about the abduction? Abduction is also gone, right? In the thenar we discussed that the abduction is, hello, thenar muscles,
Okay.
abductor,
gone.
pollicis, brevis, remember? So abduction is gone. So what happens? Thumb will be adducted, right? So you can
Yes,
see
adduction.
this hand basically resembles a
A
hand.
pen.
Is that clear? And here you can clearly see you are having, yes, thenar atrophy, right? Thenar atrophy. The eminence is absent. Why? Because the nervous supply is compromised. Whenever the nervous supply is compromised, it would lead to atrophy. Is that clear?
Yes, doc. Clear.
Okay. Okay, another thing which is one of your UWorld MCQ as well, right? So we can have like a rupture of or damage of median nerve at different points, right? Like we can have somewhere here at the flexor digitorum or the flexor retinaculum. We can also have damage of median nerve somewhere here because median nerve, you know, like run along this place, right? So whenever we have supracondylar fracture of humerus, you have a UWorld MCQ on that. Like these are your condyles. For example, if you have fracture here, right? Supracondylar fracture. Which nerve is going to be compromised? So that is your median nerve. Your UWorld MCQ. Is that clear?
Yes, doc.
Okay, let me just ask you another question. If the median nerve is gone, so which kind of deviation we are going to see? Ulnar or radial deviation?
I will see ulnar deviation.
Perfect. Ulnar deviation. Ulnar deviation of your wrist. Is that clear?
Yes, doc.
Okay, so let's discuss something about your ulnar nerve as well. So we discussed, okay, so anyone else who is going to tell me the function or the muscles supplied by your ulnar nerve? Yes? Okay, Dr. Tarun, can you just please, okay, I'll just draw it here. You are going to tell me, right? So we have your ulnar nerve. Can you just tell me the muscles which supply ulnar nerve?
The hypothenar muscles.
Okay, hypothenar muscles. What else?
And you have the interosseous muscles.
Okay, interosseous muscles. What else? What about lumbricals?
Oh, the third and the fourth lumbricals.
Okay, so the medial, third, and fourth lumbrical, right? And what about the sensory
Yes.
supply? Can I say the 1.5 of at the medial side, 1.5?
Yes.
Okay, perfect. So whenever the ulnar nerve function is gone, so what happens? You are going to see hypothenar atrophy here. You guys can see, right? Hypothenar atrophy. But if the function of lumbrical is gone again, you guys can see if you just tell this individual to, you know, stretch out his hand, so he cannot do that because the lumbrical's function is gone. So it means he cannot flex at metacarpophalangeal joint and he cannot extend at metacarpophalangeal joint. You guys can see that, right? Hello? So his
Yes.
hand would be something like that, right? A claw hand, right? So these two fingers are going to be clawed. Is that clear? Hello?
Yes.
Okay. So with this, we have ended our hand module and let's discuss our wrist, right? And tomorrow we are going to do lower limb, and right after lower limb, we will be doing like pathology and, you know, some of physiology and pathology. Is that clear? Hello?
Yes.
Yeah,
Okay. Are you
yeah.
guys able to understand?
Yes.
Okay, you know, like MSK is all about, you know, memorization, but I'm just trying my best to make sense out of that. So, okay, just give me a second. Let me just open the slides. Okay. So we'll be starting with the wrist, right? So we already know that we have like certain bones, that wrist bone, which are also known as your, yes. Hello.
Yes, sir.
So we have our metacarpal or carpal bones. Okay.
Carpal bones.
So the carpals
Carpal.
basically refer to wrist, right? So we have different bones here. You know that you have our scaphoid, like number A, this is your scaphoid, right? You have your lunate, number 2, it's your lunate, right? Triquetrum, number C, right? Okay, so this is your scaphoid, lunate, and triquetrum. What about D? What's D? Yes.
Yeah, good morning.
Hello?
Pisiform.
Okay, perfect. It's pisiform. What about E?
Then tricutril,
Okay, what about E?
tricutril, trapezoid, capitate, and hamate.
Okay, perfect. Trapezium, trapezoid, trapezoid, and
Capitate and hamate.
okay. So G is
Yep.
capitate and your
Hamate.
hamate. Perfect, right? So these are your response. Dr. Shafiq, can you just please fix your mic? Hello,
And another one of your cases came up today.
Dr. Shafiq.
And I'm reviewing your notes and
Hello, can you guys hear me now? Hello.
Yes.
Hello?
we
Okay, so
Yes.
can you guys just tell me the commonly injured, the commonly fractured bone within the wrist bone? What's the name of that? What's that bone?
Scaphoid.
Perfect, scaphoid. You have a word
Scaphoid.
MCQ on that, right? So scaphoid is most commonly injured bone, right? So the second thing, where do we find scaphoid bone? You know, at the base of anatomical snuff box, right? You have a word MCQ on that as well, right? Hello.
Yes, sir.
Okay, and how do we have injury to this bone? That's known as push injury. What do we mean by push injury? That is falling on an outstretched hand, right? So for example, if you have an individual, he's falling down on his outstretched hand, so we can have fracture of scaphoid bone, right? So that's basically screw push injury. Is that clear? Where do we find it? Palpable in anatomical snuff box. Is that clear?
Yes, sir.
Okay. Okay. So how do we have like we can have two kind of fractures of scaphoid. One is push injury, which we discussed. We can also have avascular necrosis. What do we mean by avascular necrosis? You know, the blood supply of scaphoid, basically, which artery do the like scaphoid is supplied by? That's radial artery, right? So whenever, like for example, if we have any fracture and the radial artery is compromised, it can also lead to avascular necrosis because bone itself needs a lot of nutrients, and if the nutrients aren't supplied, it can undergo necrosis, right? Loss of blood supply. So here you guys can see that basically this at the waist of the bone, it basically is the fracture, right? So then we have lunate dislocation. Let me just okay. So how do lunate dislocation occurs? Lunate dislocation. Okay, just give me a second. Let me just show you the picture here. So we know, okay, B was your lunate bone, right? Hello?
Yes, doctor.
Okay, so how can one have dislocation or trauma to lunate bone? Yes. Hello?
No, sir.
Okay. Again, you guys can see that lunate basically sit here at the top of your radius, right? So for example, if someone is having, again, push injury, what happens that this lunate bone can just push, forward, right? So what we are going to see that lunate is actually like sitting on the surface of your radius. So what happens due to like any force which is like compromising your lunate directly, so as it is sitting on the radius. So what happens after the injury, if you see the X-ray, it would be like somewhere here, right? So it's going to move somewhere here. Why? Because the radius is going to push it, right? If we have some trauma, right? So lunate dislocation, and what else is associated with lunate dislocation? A very important point which you guys should know. Like it can just move in front as well like that. So it can compromise your median nerve in your carpal tunnel. Very important, right? So whenever we have, lunate dislocation, or if it's dislocated as it is sitting on the top of radius, so it can move, like it can go forward, right? And it can compromise your carpal tunnel. And the median nerve is going to be compromised, median nerve. So here you guys can see, like for example, you have your compressed nerve here due to lunate dislocation, right? And whenever the median nerve is dislocated, like you guys can see here, okay, so median nerve, whenever it's compromised, you already know which muscles are going to be, like non-functioning. We discussed the thenar muscles, the sensory supply, and everything. Is that clear? So let's discuss our syndrome, our next topic, that is carpal tunnel syndrome, right? So can anyone just tell me what is carpal tunnel syndrome? Yes, carpal tunnel syndrome.
Median nerve.
Okay.
Convolution of median nerve.
Okay. So we have a lot of tunnel syndrome. For example, like acromegaly can do that. Hypothyroidism can do that. We'll be discussing each and every cause, right? Like for example, if we have an individual, he's having acromegaly. So what's the main feature of acromegaly? Increased growth hormone. What happens? The bones are going to be enlarged, and whenever the bones are enlarged, it can compress upon the median nerve. Is that clear? So we can have median nerve lesion. And we already know if in the carpal tunnel, the median nerve is compromised, we know the details. What's going to happen? The thenar muscles function is going to be compromised. The lateral two lumbricals, the sensory supply, 1/3, a sensory supply of your fingers. Is that clear? So I think we should not go in that detail. What happens when median nerve is compromised, right? So it's important to know the causes of carpal tunnel syndrome. Is that clear? So okay, so anyone who can just tell me the cause, two of the causes I just told you, right? So it can be due to hypothyroidism, it can be due to acromegaly. So there is an important cause, okay? Let's discuss that. Do you guys know about amyloidosis with beta-2 globulin? Hello? Or dialysis related amyloidosis. Really high yield, very important. You are going to see a lot of MCQ on that. First of all, can you guys just tell me what is beta-2 microglobulin? Or dialysis related amyloidosis, very high yield. Dialysis related amyloidosis. Yes. But what is beta-2 microglobulin? Anyone, please raise their hands.
Is that part of the MSK too?
Yes, perfect. MHC1, not 2, right? So we discussed the structure of MHC1. Remember, on all nucleated cells, we have MHC1, right? So if you just zoom in the picture of MHC1, you have a globulin, which is known as beta-2 globulin. Remember, right? So it's basically a part of this MHC1 receptor. Like you have alpha 1, alpha 2, alpha 3, and beta-2 microglobulin. So those individuals who are on dialysis, like what's the main goal of dialysis? Basically, you are filtering out the blood, right? You're just fixing the, you're just removing the toxins, right? But remember, this beta-2 microglobulin cannot be filtered through dialysis, right? Through dialysis. We'll be discussing this concept again and again, right? So what happens with time, this beta-2 microglobulin accumulates in your body, and it would lead to amyloidosis. What is amyloidosis? Whenever certain like beta-pleated sheath, proteins, or similarly disorganized proteins deposit in different structures of your body, that is known as amyloidosis. We'll be discussing amyloidosis in detail, don't worry about that. But what's the main idea? Whenever, an inappropriate or disorganized proteinous structure deposited in different parts of your body, that's simply known as amyloidosis. So we have different types of amyloidosis, right? We'll be discussing that in detail. But what happens here, dialysis cannot filter out your beta-2 globulin, which is basically structural component of your MHC1. So with time, beta-2 globulin can accumulate, and what happens, it would start depositing in different structures of your body, And one of that is, yes, flexor retinaculum, which can give you carpal tunnel syndrome. Is that clear? Hello? Carpal tunnel syndrome, right? So can anyone just please repeat the concept? What is, beta 2 amyloidosis? Why can it give us carpal tunnel syndrome? Anyone? Please raise your hands.
During dialysis,
Yes, Abdurrahman, please.
during dialysis, the beta 2 microglobulin cannot be filtered out, and because of that, it gets deposited in the flexor retinaculum, and it leads to the carpal tunnel syndrome.
Okay, perfect. That's perfect. Okay.
I have a question.
So I think, yes, please.
So that is the only place it's gonna be deposited, or anywhere else in the body as well?
Okay,
like
so
any
it
other-
can deposit in different places, right? Once it's built up, like you have like a deposition in different parts, right? Not only hand, but one of the classical deposition like point which we are going to see is here, right? So it's going to be deposited here, and which can give you carpal tunnel syndrome. We'll be discussing in detail amyloidosis, like it's basically a chapter of pathoma, the second chapter. So we'll be discussing that in our minors once we discuss it, right?
All right, thank you.
Okay, so we have like 2 fractures remaining, so I think we should just continue tomorrow. And tomorrow we'll be finishing the anatomy portion. Like we are only left with hip joint and lower limb, right? And the plexus there. So thank you so much for staying here. Hope so you guys enjoyed the lecture. As I'm telling you guys again and again, like, MSK is something, pure memorization. So hope so things are making sense. And thank you so much, right?
Thank you, sir.